Hey everyone, Blaine here. I was told to start a YouTube channel to document my testosterone journey. Now, for those of you who do not know me, I'm Blaine. I am 33. I am a parent, a librarian assistant, and a biology student. I am starting testosterone here soon so that I can look more androgynous. My goal is not to completely look male to female to male. My goal is to look androgynous. I'm only going to go on a light dose of testosterone. Currently speaking, due to some other hormonal issues, I have actually started a medication called Lupron. And what Lupron does is it blocks all the estrogen from coming into your body. And that was done by my primary care physician. This was done not to encourage the testosterone or anything like that. It was actually done to prevent me from having cysts and complications with polycystic ovarian syndrome as well as endometriosis. I have been on that for almost 6 months. I have had some side effects with it. Some of the side effects include weakness, a little bit of bone density loss. I've had some hormonal changes, such as my weight fluctuating. I actually increased my weight, much to my dismay. I am hoping that testosterone will kind of balance it all out a little bit, but I can't make any guarantees on that. I have already had my first doctor's appointment, and I will remain quiet on who my actual doctor is, but I can refer to them. So far on my first doctor's visit, which was a couple of weeks ago, what they did was they did the usual blood tests. They did a diabetic screening. They did a hormonal check to see where my hormones stood, because as I said, mine have already and almost always have been out of balance. So now we're just trying to see how far out of balance it was. And then I have another appointment this week coming up to get the results of that, as well as possibly set up the psychiatrist review of myself, because in order to start testosterone you have to have a psychiatrist sign off on you. Now, I've done that before with Eskenazi Health, however, because it's been a few years, they're having a hard time finding it, so I may have to redo that again, which is perfectly fine. I have a psychiatrist and a therapist that are willing to sign off for me. Much to a lot of people's unknowingness, you can't just walk in and say, hey, I want to start testosterone, and walk out with a script. It doesn't work like that. It doesn't work like that with estrogen either. You have to go through a bunch of hoops. For me, I've had to do all the blood tests, and I have to go get approval by a psychiatrist. I've already had my name changed to something that I preferred. So my preferred name is Blaine, and you're free to call me that. I use they, them pronouns for those who do not know. As I said, this is kind of the fresh start for me. It's me being able to be more comfortable in my own skin. And like I said, I don't want to go full testosterone. I don't want to go, I don't necessarily want to have a beard. I mean, sometimes I feel like that, but it's a very little bit versus a lot. I want to just look more androgynous, and that is my goal. That's why I was hoping to have like a low form of testosterone. From my understanding, I already have a small amount of testosterone in my body that is increased more than what other people's is. But here's hoping to add more to that. I am really hoping that this works out well for me, and I hope that it helps me clear my head a little bit and feel a little bit more confident in myself, because dysphoria is a thing. One of the things that I have a hard time with is binding, and for all of you bigger chested people out there, it's definitely something that is really hard to do when you are a G. I'm just going to be honest, it is, especially in the winter and summer time, especially in the summer. It gets so hot, and you have to deal with sweat and just all kinds of things going on. And I have asthma, so for me to bind, it restricts my chest cavity even more, and it hurts my lungs, and it causes my asthma to get inflamed. So though I have a binder, I don't always wear it and appear to be cis female normally. I have had a lot of people come to me and say, well, you don't act trans enough to be, transitioning. And to that I say, I'm sorry that you perceive life to be that way, that you have to have a certain amount of trans level to be trans, because that's not the case. Every day I feel dysphoria, and every day I feel out of whack with my body because I don't look non-binary enough, because that's what I am. I'm non-binary. I don't fit the mold of either male or female. I'm somewhere in between. And I'm hoping with a little bit of testosterone every month that I can look like that. And for those of you that are still in the closet or are still questioning, am I non-binary enough? The answer to that is yes, you are. Whether that's a low scale amount of non-binary or full on, don't refer to me as either male nor female, I want to be completely non-binary. I want to look androgynous, which is about where I'm at. I want to look androgynous. The ultimate goal for me is to have people actually question, is that a male or female, because that's my goal. I don't want to look like either, really. I want to look androgynous. So here's to a fresh start, and hoping everything comes out okay. I'm going to try and do these after every doctor's appointment, so it'll probably be about once every 2 weeks. And it may be a little bit more than that once things start going, like testosterone and stuff, just so I can show the physical changes. Just currently, right now, I have purple hair, which you can't see because I just got out of the shower. But you can kind of see it a little bit. But I have purple hair, and I have my nails done. I went and got my nails done because it's something that I enjoy doing. And I don't care whether you're male or female, or in between, or neither. If you like getting your nails done, go get your nails done, because I got a hand massage and my cuticles have never looked better. And let me tell you, from somebody that shelves books all day, a hand massage felt wonderful. But I hope everybody has a great day and follow along with me on my journey. If you'd like, just don't forget to hit the subscribe button so you get notifications whenever I go live. And I hope you all have a great day and a great week.